Hello, everyone. Welcome to our weekly ICSC Club. I'm Hazel, the host of this session. Today, we excited to have Julie here, sharing her reviews on the signatures of IBD or the inflammation bowel diseases after anti-TNF treatment. She'll be presenting findings on the natures of inflammatory bowel disease following anti-TNF treatment. So this research provides, I think, valuable insights into the underlying mechanisms of IBD and also the potential for targeted therapies. Okay, so before we dive deeper, let's quickly outline what we'll be discussing today. Okay. Okay, as you can see in the agenda here, Julie will be covering the following part of the session. First of all, she'll give you an overview of inflammatory bowel diseases as an umbrella term, and also Crohn disease and ulcerative colitis within the bowel disease, like a brief introduction. And then we got 4 questions. First, is the investigation of changes in cell state, like compare the disease and like different regions in IBD patients, whether it's inflamed or non-inflamed, and also compare with normal control. The third part, which is the second questions, will be investigate the differences between Crohn disease and ulcerative colitis. She will explore the unique characteristics of each disease, which lead her to the third question about the epithelial cells. Like basically, she found the changes in epithelial cells, and then she wondered like whether these changes might affect the treatment outcome in Crohn disease and also the ulcerative colitis. And last but not least is the investigation of upregulated genes in epithelial cells of remission patients. Okay. Now, let's hand it back to Julie to kick things off with an overview of IBD. Okay.
Yeah. So to give a little bit of a background on some of the common inflammatory bowel diseases, today we'll be focusing on Crohn's disease and ulcerative colitis. These two diseases are quite similar to each other. However, they have some slight differences in the pathology. So for example, in Crohn's disease, we see some partial inflammation of the digestive tract. Whereas in ulcerative colitis, we see more of a continuous inflammation of only within the colon. So ulcerative colitis is localized to the colon only. And there exists this one treatment, anti-TNF or anti-tumor necrosis factor, also known as adalimumab, which treats both Crohn's disease and ulcerative colitis.
Okay. Before moving on, I have 2 questions that I would like to ask Julie. First of all, why do you choose IBD and also like Crohn disease and ulcerative colitis as the topic of research?
So it's quite a popular topic of research among scientific groups right now because it's estimated that about 10 million people worldwide are affected by inflammatory bowel disease. So it's very an interesting research to topic or interesting topic to research, excuse me.
Yes. Okay. Yes, I understand. Like I can see there are many research groups studying bowel diseases in general and also the Crohn disease since the disease effect is really severe. Okay.
Right.
And then my second question is about the treatment that you mentioned, the adalimumab. Can you elaborate on how does this drug or like this treatment work to suppress the inflammation in IBD patients?
Yeah, so this anti-tumor necrosis factor, it's an antibody. It basically reduces inflammation within these inflammatory bowel diseases. So this is more of like a palliative treatment for patients because there do exist some more severe conditions where patients have to undergo more invasive procedures such as surgery. So basically this drug just helps to reduce and manage the inflammation within these patients.
Okay, thank you, Julie. I got that. Okay. Now I think you can move directly to your first findings. Yeah, thank you.
Yeah. So to explain a little bit about the data set that we're going to be using in this case study, so it comes from this paper where authors performed a longitudinal single-cell atlas of anti-tumor necrosis factor treatment in inflammatory bowel diseases. So again, we're just looking at Crohn's disease versus ulcerative colitis. The authors were able to take samples from 5 different regions of the gut, as you can see here. And then within those 5 regions of the gut, they were also able to take samples from inflamed regions and also non-inflamed regions as well.
Yeah, I can see that. Okay, thank you. Okay. Then we can move on. So this is the actual research paper that you work on and investigate the findings from. Is that correct?
Right, right. So there's a lot of questions that we can ask here, but moving on to the first type of question we can ask. So here, I wanted to investigate the cell composition differences or the cell state differences between inflamed regions and non-inflamed regions first. So in the top right here, we have our non-inflamed region. I see that it has more of an epithelial cell abundance, a higher proportion of epithelial cells. And we know that these epithelial cells play a role in vitamin absorption and fatty acid metabolism. So these are important functions for healthy gut, right? Whereas on the other hand, we have the inflamed regions, which are more abundant in immune cells, such as our B and our T cells. And this is in line with the fact that inflammation equals higher immune cell activity.
Just to make it clear, you mentioned inflamed and non-inflamed regions. So both of these regions come from IBD patients, right?
Yes, so that's right. So right now we're only looking at our diseased or our IBD patients. And within these patients, you can take inflamed regions and also non-inflamed regions.
Okay, I got that. When you compare the inflamed to non-inflamed, yeah, I can see from the composition chart right here, like there's a significant shift in the cellular composition. Like in the inflamed, we have more immune cell. Inflamed, we
Right.
got more epithelial cell. Yeah, yeah,
That's right.
okay, yes,
Mhm.
thank you. Yes. So from this finding, what leads you to like where the
All right. So from here, we can investigate the more specific cell composition differences between Crohn's disease and ulcerative colitis. So in Crohn's disease, in our inflamed region, I see a larger proportion of the CD4 positive T cells. And then when I look at the highly expressed markers within these CD4 positive T cells, I see genes such as STAT1 and STAT4. And these 2 genes are markers for this Th1 cell subtype. And this is a subtype of the CD4 positive T cells. Right. And because I see this, this leads me to my next question about whether this unregulated Th1 cell expansion may or may not contribute to the pathogenesis of Crohn's disease.
okay. So from the first finding, like you find more immune cell in the inflamed region. Now you go deeper into the cell type within that enriched population, and then you find like a Th1 or like a is
Right.
that a subtype of T cell?
Yeah, so Th1 is a subtype of the CD4 T cells. That's right.
Okay, so you see like that in Crohn disease. Okay, in Crohn disease, there is like a distinct Th cell signature uh enrichment, like STAT1 and STAT4, and also you see like a big proportion of Th1 within immune cell of Crohn disease. Okay, so
Yes.
we're talking about the Crohn disease. How about ulcerative colitis or other bowel diseases as well? Do we see Th1 as
Mhm.
well?
So in ulcerative colitis, we actually see a different cell subtype. So again, in ulcerative colitis, we do see that higher proportion of CD4 positive T cells in the inflamed regions. However, when we query for or when we look at the highly expressed genes within this proportion of cells, we can see a high expression of BATF, IRF4, RORA, and STAT3. And in combination, these are cell markers for the Th17 subtype of cells. All right, so
Yes,
this is
and
different from Crohn's disease.
okay. So like in the Crohn disease, we have Th1, and in ulcerative colitis, we got Th17. Okay. Can you elaborate more about the role, or like what are these cells? Like what do they do?
Right. So at this point, we don't know too much about the function of these types of TH cell subtypes because this is quite a new finding that the authors were able to find from these papers. But perhaps we can try to glean more information as we get further into the analysis.
Interesting. So Th1 and Th17 is still very less, very small research about the role of these cells. Like
Right, right,
is
especially in
quite a new.
IBD. Hmm.
Okay, yes, thank you. Okay, great. Okay, now we see like a differences between Crohn disease and then ulcerative colitis. What next questions do you have in mind after this
Right.
finding?
Okay, so some other ways we can investigate the differences between Crohn's disease and ulcerative colitis is by looking at the pathway differences, especially in the CD4 positive T cells. So from here, I can go on to my first question. So here I want to look at the differential gene expression between Crohn's disease and our normal condition. And when I do the analysis, I see an upregulation in genes such as CDC42 and DDT. Now, CDC42 is a cell division cycle gene, whereas DDT regulates lipid metabolism. And together, these genes may be related to how immune cell proliferation induces lipid metabolism changes in inflamed states in Crohn's disease.
Okay, wait me 1 second. Let me take a look at the heat map right here. So this is just to give more information to the audience, to our audience here, like in order to investigate the gene expression differences and also the pathway differences between the Crohn disease and ulcerative colitis. What you have done is like you made two comparisons. First, you compare Crohn disease to normal, and second, you compare ulcerative colitis to normal, and then you show us the findings from that. Is that right?
That's right. We want to compare our disease to our normal first to see what kind of diseased um, phenotype genes are upregulated in our condition.
Yes. Oh, so I just see one question, and yeah, so accidentally we just answered that question. The question is like, is this inflamed and uninflamed in Crohn disease? So the answer is no. This is Crohn disease in general compared to normal control, like normal participant. Yeah.
That's right, right.
Thank you. Okay, thank you. So we can see the enrichment of CDC42 and also DDT. Now I believe coming up next will be the pathway enrichment results, right?
Yes, so from here we have specific genes that might tell us about these pathway differences, but we can also do some pathway enrichment tests. So when I compare Crohn's disease versus our healthy, I see high expression of these pathways such as TCR signaling, JAK-STAT signaling, and IL-12 signaling. Together, I see that TCR signaling is involved in T cell signaling, inducing cytokine production, whereas JAK-STAT signaling and IL-12 is more involved in Th1 cell differentiation. So again, this ties back to our previous finding where we found that Crohn's disease was more enriched in this Th1 cell subtype.
Okay, see, I see. Oh, so this is interesting because since we are seeing the actual pathway involved in the enrichment of Th1, then maybe if we can target this pathway, like if we can shut down the JAK start signaling and or like interleukin 12 signaling, maybe we can stop the enrichment of the cells and also maybe reduce the inflammation in Crohn
Right,
disease. Do you think
right.
that?
That might be one mode of action that we can use when thinking about therapeutic treatments. Yeah.
Okay, great, great. Okay, now Crohn disease. How about ulcerative colitis?
Okay. So in ulcerative colitis, again, I compared ulcerative colitis to normal, and I found that the upregulated genes are the IgHG and the IgKC genes, and these genes are involved in immunoglobulin receptor binding activity. And
Oh,
here we can,
one,
um,
one second. My
yes.
slide is still in the pathway style. Oh, okay. Yeah, okay, thank you.
Okay, sorry, it's lagging a little bit.
Yeah,
So
it's
again, we
don't worry.
see we see upregulation in the IgHG and IgKC genes. These are immunoglobulin receptor binding activity genes. And this leads us to believe that maybe perhaps elevated immunoglobulin activity is indicative of autoimmune disorders. And this is what IBD is. It's an autoimmune disorder with an overactivity of our immune cells.
Okay, I think like the like globin enrichment. Okay, and then this can okay, as my like based on my knowledge, this can involve B cells and also antibody production. Okay, and
Right,
these
right.
again may contribute to the pathogenesis of UC. Okay. Oh, I just see
Hmm.
one question related to the heat map right here from Christine. So Christine asked what to fold chain here, and also do we have any? I think like what is the log to fold chain threshold here? Do we have a threshold for this one?
Yeah, so I didn't apply a threshold here, but typically you can see here this might be around the 1.5 or the 2 log fold change threshold. However, in the platform, you can also define what the threshold here is. So if you see way over here, this gene WDR830S, it's more on the closer to 8 or 9 fold change.
Yes. Like
Right.
I think if uh this gene has like a log to fold chain value of up to 8, it's like a big difference between the disease and the normal. Yeah. Yes.
Exactly.
Yeah.
Yes.
Yes. Oh, following question from Christine. Did you subset the cells here, or are we looking at all the cell within the cell atlas?
So right here, we're only looking at the CD4 positive T cells at this point.
Okay. So for Christine, uh, this comparison is making based on CD4 positive T cells only. Yeah. Okay.
Yes.
Yeah. Okay. Thank you. Okay. Then, yeah, thank you, Julie, as well. Now I
Mm.
think we can move on with the pathway enrichment of UC. Yeah, thank you.
Okay. Yeah, so some of the enriched pathways that we see in ulcerative colitis involve, again, TCR signaling. So this is T cell signaling inducing cytokine production, same as what we saw in Crohn's disease. But also, differently, we see actin and cytoskeleton activation. And the reason why we might be seeing this is because there might be some recruitment of immune cells to these inflammatory sites.
Okay. So we see upregulated of actin and cytoskeleton activation.
Right.
Okay. Yes. Oh, so I can see quite like different in the Crohn disease and in the colitis. Can you,
Mhm.
Julie, can you please give us like a little overview of the comparison between the of pathway enrichment so that we can
Right.
have a little for this part?
Okay, so basically to summarize our findings so far, so in Crohn's disease, we see an upregulation in lipid metabolism genes, and we see pathways enriched related to this Th1 cell subtype differentiation. Whereas in ulcerative colitis, we see more of an upregulation in immunoglobulin receptor binding activity genes and pathways related to actin and cytoskeleton activation. So already through the pathway differences and the differentially expressed genes, we see these molecular differences between these very similar conditions.
Oh, okay. Thank you, Julie. So we have the summarize for the pathway differences in CD and UC. Okay. Before we moving on to the next part, we have one question from Paramo here about, I think, the experimental design. Okay. So are you looking at only cells that are not treated with the drug?
Yeah, so at this point, we are not looking at any treatment time point yet. We're just looking at pre-treatment, previous treatment, just to kind of characterize these disease states and see what the differences are.
Okay, so these are just like non-treated cells, like naive cells. Okay.
Yes.
Yes. Yes. Thank you, Julie. And also thank you, Paramo, for your question. Now we're moving on with the next part, into the next question. Okay. Can we move on? Okay. Thank you. I think it's a little bit lagging on my end here.
Wait for it to change.
Yes. Still waiting. Okay. Did you like do it change on your end? Oh, okay. It changed on my
Yeah.
end here. Okay.
Okay.
Now, yeah, thank you. Now we move on to the next part. I think I will give a little introduction to this question because I really like this part. Now is the next question. Okay, so now we have the overview of the molecular differences between Crohn disease and then ulceritis. And we will just have the question from Paramo about the treatment. Now this is the question for that, which is like, can we understanding the cellular and molecular changes? Can this understanding help us predict the patient response to treatment? Like, okay, Julie, so could you please elaborate on findings regarding the potential of cell composition to predict the treatment outcome?
Right. So in the data set, the authors treated both conditions with anti-TNF, and then after treatment, they classified patients into two groups. One remission group, which is basically where the treatment was successful and they were able to see less inflammation, and then one non-remission group, where they were able to see not many changes in the disease at that point. So I wanted to see if, well, in the patients that were successful after treatment, was there anything about their cell composition or their gene expression profile that could possibly predict their outcome with the treatment? So
Okay.
here in this first results, okay, right here. So
Okay.
in Crohn's disease, in the remission group, we see an increased proportion of epithelial cells. And if you remember from the beginning, in non-inflamed and in healthy states, we do see, again, this increased proportion of epithelial cells because their function is important to healthy gut function, right?
Mm.
And so from here, I want to ask, well, perhaps do these epithelial cells in the remission group have a different gene expression profile? Are there any genes that stand out that may act as a predictive marker for whether or not these patients can be successful in their treatment?
Okay. Now we're talking about treatment. This is anti-TNF treatment, correct?
Yes, that's right.
Yeah, okay, okay. So this composition chart I can see is very similar to what we saw in the beginning of this session. Like this is post-treatment and pre-treatment. After anti-TNF treatment, I can again see an increase in the proportion of epithelial cell. Okay, so maybe like I think just my my thought, like maybe that the restoring of epithelial barrier functions like can be very crucial for
Mhm.
achieving and maintaining the remission in Crohn disease. Okay. So, okay. So, given this observation, I'm curious to know if you investigate whether these epithelial cells in remission patient have a distinct gene expression profile compared to those
Mhm.
in the non-remission patients.
Yes.
Yeah, yeah.
Okay,
Yeah.
so furthermore, I wanted to investigate if there were any high expression of any genes within these epithelial cells. And I found that this one gene in particular, CD74, was very highly expressed in the remission inflamed region group. And doing some literature search, I was able to find that this gene, CD74, is linked to inflammation and to intestinal epithelial cell regeneration and also promotes mucosal healing, which is very interesting. So this ties really directly back to perhaps this gene could be promoting this mucosal healing, leading to the success of this treatment.
Okay. So we have CD74, which based on literature promoting mucosal healing in Crohn disease. Okay. Do we see this enrichment in the colitis patients as well?
So, yeah. So in ulcerative colitis, while we don't see CD74 in particular, we were able to find a different gene called DMBT1, which is right here, highly expressed in the remission inflamed region. And again, doing a literature search, this DMBT1 gene
Oh,
perhaps may be a
different.
regulator of mucosal homeostasis through mucosal defense and regeneration. So again, there's this common theme between Crohn's disease and ulcerative colitis of this upregulation of mucosal defense and regeneration, promoting the healing within the gut.
Okay. Just to sum up, we have CD74 for Crohn disease and DMBT1 for the ulcerative colitis as the genes that you would like to highlight for this comparison, right?
Yes, that's right.
Okay. So based on this finding, what questions, what can we find next from this?
Yeah. So furthermore, I wanted to expand on the scope of the analysis because so we basically found these two genes that are important in this one paper, but I wanted to expand my scope by asking, well, do I see this upregulation in genes within this specific group in other papers as well, and compare across these multiple studies in IBD in general? So that's where I
Mm,
took this analysis further and was able to find or was able to use talk to data to compare across multiple studies.
okay. Oh, just talking about talk to data, Perimo is asking like, are these data sets already in the Biotrain database, like the one that you use today?
Yeah, so this one is actually in early access, I believe. So you would have to go to the early access link. If you're interested in finding out about that, we can follow up in a follow-up email as well.
Okay, so yeah, for Paramount, yeah, yes, you can find this data set in the early access page advisory, which I believe we will follow up you, like we will type the question for you, right?
Mhm.
This, yeah, thank you. Okay, moving on with the big question on the bigger picture,
Okay,
not only like one data set here. Okay.
yeah. So in this analysis where I compared across multiple studies. So at first I wanted to confirm whether I saw the same mucosal healing genes that we saw in the previous slides, for example, CD74, if I see the same high expression across multiple studies. And this is what I did here in the new talk to data. So I combined different studies involving just inflammatory bowel disease in general. And then I wanted to compare our non-response and our response groups. And here you can clearly see there's a very high expression of CD74 in the response group compared to the non-response group, right?
Mm,
And then here on the right-hand
I
side, we are looking
see.
at a heat map. Yes, so basically, from here, I wanted to see whether there are any more genes that we can find related to mucosal healing that may predicate the um, treatment response after treatment. And comparing our response and our non-response, I see a couple of these genes. However, these genes are not necessarily related to mucosal healing. Instead, I found that these genes might be related to inflammation instead. But nonetheless, this is still an interesting finding.
Mm. I found this heat map quite interesting, so I have several questions for this heat map actually.
Mhm.
First of all, I would like to know how did you generate this heat map? Like this is differential gene expression analysis, right?
Yes, so this was actually differential gene expression analysis that I performed in the new version of Talk to Data, and you're able to perform a heat map visualization like this.
Okay, okay, that's the first question. Now the second question. In this DG analysis, what cell types you included into the analysis? Like, or it's just like all respond and non-responder in general?
Yeah, so since I wanted to keep my question pretty general and not narrow the scope yet, this is actually including all cell types within this inflammatory bowel disease. So we're not really looking at any specific cell type as of yet.
Okay, I think that the findings that you mentioning earlier about these genes are not actually belong to any specific cell types is understandable because
Mhm.
you said like all cells within the responder and non-responder. It can be either, as I can see here, it can be either macrophages as the FCN1, or it can be even T cell, or it can be even like epithelial cells in this case. Okay.
Right, right.
Yes,
Mhm.
thank you. Okay. I think this is interesting. Like we can use this one for just like hypothesis generation. You can find as many differentially expressed gene as possible. Okay. Yeah, thank you for
Mhm.
your explanation. Okay.
Yeah, absolutely. Okay.
Okay. Okay. So what else do you have to share with us today?
And I think from here, this completes the analysis, but of course, this is a very comprehensive paper with a lot of data involved. So there's a lot more questions you can ask. You guys can feel free to explore this data set because it is publicly available through early access. But for now, I can summarize our findings so far.
Yes, thank
Okay.
you.
So to summarize, first we found that inflamed states in IBD exhibit immune cell abundance, whereas non-inflamed states exhibit epithelial cell abundance. And then we also found that in Crohn's disease, this was upregulated in lipid metabolism pathways and Th1 cell differentiation. Whereas in ulcerative colitis, we found an upregulation in actin and cytoskeleton pathways and Th17 cell differentiation. So we see these pathway and molecular differences between Crohn's disease and ulcerative colitis. And then next, we found that the remission group in both Crohn's disease and ulcerative colitis have a high expression of mucosal healing related genes. So that is something that they have in common. And then furthermore, to expand on the scope of my question, I also found that the remission group across multiple IBD conditions have a high expression of inflammatory genes.
Okay, yes, thank you so much. Thank you so much for your summary, and also thank you, Julie, for I think this is a very excellent presentation.
Yeah, thank you.
Uh, like based on the summary here, I believe that this finding provide a very valuable insights into the mechanisms underlying IBDs and Crohn disease and ulcerative colitis as well. Like these kind of findings, I believe, could have like an implication for the development of new therapeutic strategies, new targets. Yeah. Okay. Now I think that's all for the presentation today. Now we can open the floor for questions from the audience. Okay. Okay, here. Oh, so we have one question here. Okay. So what are the specific cell types for CD74? So do we have any specific cell type for CD74?
So you're talking about here, right? Yeah, so here
Yes,
we're
there.
only looking at epithelial cells. So this is CD74 only in epithelial cells.
Yes, okay. I just actually like for this question, I just did a quick Google check. I can see that CD74 can express in B cells. So I think another immune cell probably, but yes, for Julie experimental design in this case is specifically found upregulated in epithelial cells, which is I think
Epithelial cells.
interesting. Yeah.
Mhm.
Okay. Okay. Now we got one question from Nabi, from Nabi. Okay. How do you interpret point five? I think question five. Like, why would there be high inflammatory gene expression in the remission group?
Yeah, so that's an interesting question to further do some analysis on. That's true because I guess we expect, since after treatment, we expect probably low inflammation, but maybe another way we can think about it is that perhaps these are not markers for pro-inflammatory or yeah, so these are may not be necessarily markers for pro-inflammation, but these may be markers for um, subduing inflammation instead.
Yes, I think
Yeah.
these points definitely need, more investigation.
Yes,
The
absolutely.
the clear to provide the clearest explanation. Yeah, for this one. Okay. So thank you, Nabi, for the question, and thank you, Julie, for the explanation. Next, we got one question. Okay, from Christine. First of all, thank you, Christine. She gave us like a compliment. This is a great talk. Thank you. And okay, for the
Thank you.
question, does the inflamed genes in the remission groups overlap with the original inflamed genes from IBD or Crohn's disease?
Mhm. I think that is also another question that we can definitely investigate in a further analysis because at this point I did not perform any analysis for that question. But that is something that you can explore in this data set to see if there's any overlapping genes between our groups of interest.
Okay, yes, thank you. Thank you. Okay, thank you. Oh, I think we a little bit overhead the time. Yeah. So yes, thank you everyone for a very great session. And especially thank you, Julie, for the presentation. I think we
Yeah.
will stop the session here since we quite a little bit over the time. Okay, and thank you all and see you next week. Okay, bye.
Yes, thank you. For those of you who we haven't answered the questions, we can follow up in an email as well.
Yes, yes. Okay. Thank you,
Yeah.
Julie.
All
Thank
right.
you, everyone.
Thank you,
See
everyone.
you.
Bye.